I'm Shernan Holtan. I'm one of the blood and marrow transplant physicians at the University of Minnesota. Today I'd like to tell you about a patient of mine. This is a real life patient. So imagine a woman in her 50s, healthy, no medical history, mother, doing well, until she's diagnosed with acute myeloid leukemia. This is a life-threatening cancer of the bone marrow. She is admitted to the hospital for treatment of this leukemia. It's a difficult leukemia, meaning it requires intensive chemotherapy to get into remission. So she receives that chemotherapy and unfortunately has some complications, as is common with intensive chemotherapy for leukemia. She develops fevers. She's treated with antibiotics. She gets more fevers, more antibiotics, and she develops a complication called Clostridium difficile colitis, or C. diff colitis. This is treated as well with antibiotics, and she improves. But unfortunately, the chemotherapy didn't do enough to clear her bone marrow of her leukemia. She needed even stronger chemotherapy. And so after 14 days of the initial intensive chemotherapy, she actually has to receive even stronger chemo. This is at a time when her intestinal tract is already beaten down with chemotherapy and antibiotics and C. difficile colitis. She receives the intensive chemotherapy and has a bumpy course with more fevers, more infections, significant diarrhea, a lot of abdominal pain. She can't eat. She needs parenteral nutrition in order to receive enough calories to survive, but she makes it through. She's able to get out of the hospital. When her blood counts recover, her immune system recovers, she is finally in remission. The chemotherapy was able to get her leukemia back under control, and she leaves the hospital. So the initial chemotherapy worked. Our patient is in remission, but without an additional therapy, her leukemia will come back. So now she comes in back to the hospital for a bone marrow transplant. This is the only known cure for most of these difficult to treat leukemias. She receives more chemotherapy and more radiation to treat her leukemia, to get it completely in remission so that the new stem cells that we give her will take in her bone marrow. She unfortunately has more fevers, more infections as a result of the intensive chemotherapy and radiation. This is common, this is expected. Her C. difficile colitis comes back. We see this as well. This happens because of the intensity of the treatment that's required for her leukemia. But she gets her new stem cells and she is able to recover eventually. When her blood counts recover, they're her new donor stem cells. Her new immune system is coming in and she is able to leave the hospital. However, shortly after doing so, her new immune system kind of turned against her. She developed graft versus host disease as her new immune system recovered. Graft versus host disease is a life-threatening complication of blood and marrow transplantation where the donor immune cells attack tissues and organs. This is a common complication of blood and marrow transplantation. The most serious organ that can be affected is the intestinal tract, and this often occurs after someone had prior damage to their intestinal tract from previous chemotherapy, radiation, or infections, and she had all of these. She developed significant intestinal GVHD, which required immune suppression with steroids and a lot of TLC. So support to get through a very difficult time with her intestinal tract not functioning. She needed briefly some more parenteral nutrition until her GI tract recovered enough to heal and get her back out of the hospital. So now she's recovering from graft versus host disease. We're able to reduce her immune suppression. She's eating better, she's gaining weight, she's feeling stronger. We're monitoring her very carefully. She's able to be back at home, feeling more like herself. As a part of her monitoring, we check another bone marrow biopsy, and unfortunately we see that her leukemia has come back. This time, there's not a good treatment that we can offer, and she ends up dying from leukemia. So why am I telling you this story? This is the story of a real patient and patients I see every day. There are a number of steps along the journey where I think we can do better for their care. The first step is making the intensive chemotherapy required to get leukemia in remission easier to tolerate. It has to be strong chemotherapy, but can we do more to support the body as it's recovering from this? So our investigators at the University of Minnesota are looking at new ways to try to support people through this challenging chemotherapy. One of the ways is to see if we can provide microbiota support as they are recovering from chemotherapy. We know that patients very frequently get fevers and antibiotics and secondary infections as a result of those. The next way that we can do better in helping recover from blood and marrow transplant is prevention of graft versus host disease. This is a common complication. Historically, the way that we dealt with this was increasing immune suppression, but this ends up having a result of potentially increased relapse risk. So in this patient, she had a high-risk leukemia. She did get graft versus host disease. It was treated with immune suppression and she got better. But did this allow an opportunity for her leukemia to break through? If we can reduce graft versus host disease and all of the difficulties from that, perhaps we'll have more people who are still here with us because their leukemia or other cancer will have a chance to grow in the environment of very intense immune suppression, and patients won't have to go through the hospitalization and poor nutrition and weight loss that's associated with GVHD, which would be a huge win as well. And so how ACT is helping with this directly is supporting a clinical trial where, just like after the leukemia therapy, we're attempting to restore the intestinal microbiota to see if we can eliminate the GVHD risk, then eliminate the immune suppression that's needed after that, to hopefully have people live better lives without GVHD and reducing their risk of relapse as well.